Hello and welcome to today's episode of Coronavirus TV. Today's topic is mathematical models of COVID-19 and the immense difficulties in building accurate models for a pandemic like this, which explain why different models give such vastly different projections. So the basics of an epidemiological model need to know how many people in the population have an infectious disease. Then we need to know how many people each of those people who has the disease is likely to infect as a new case of the disease. Finally, we need to know how many people who get the disease are likely to need advanced medical support, such as ICU beds and ventilators, and also the mortality rate of the disease. How many of the people who get the disease will die from it? Of course, knowing the mortality and the need for advanced medical support, as well as the total number of people getting sick, all have implications for planning for an appropriate response to a pandemic like COVID-19. However, it's really hard to build an accurate projection for something like COVID-19 because the predictions all start with knowing how many people in the population are susceptible to the disease and how many people currently have it, the point prevalence. We know that a lot of people with COVID-19 don't show any symptoms. And because of various different testing practices throughout the world and limited numbers of available tests, most of those people who don't show symptoms aren't getting tested. What that means is that we don't have the critical information of how many people in a population have the disease and have the ability to spread it to other people. So if we were trying to do something simple, like multiply X amount of people have the disease, each person will spread it to Y amount of people. And each of those people, X proportion of those people who get the disease will need advanced medical care and Z proportion will die. We don't have the number of people who have the disease right now to build that projection from. Current estimates of the CDC, the Center for Disease Control in the United States, estimate that up to 25% of people who have COVID-19 are asymptomatic, meaning they are those people who don't show any symptoms and most definitely, in most cases, are not getting tested. But we also know that even sick people aren't always tested. In a lot of cases, only the sickest people likely to require hospitalization are actually getting tested for the disease, and people who are mildly ill are being told to just stay at home and self-isolate. So even if we knew how many people each person with COVID-19 was on average going to infect and create a future case, we don't know how many people in the population currently have the disease and can spread it to other people. So that makes all projections of the amount of people ultimately getting sick and needing hospital care inaccurate. So some populations that we've seen have given us unique abilities to actually test everyone. For example, the Diamond Princess in the US was one of the first cruise ships that got quarantined, and nearly every person on board that ship was tested. So these are kind of the rare instances where we can estimate how many people in the population are asymptomatic, and only by knowing that asymptomatic number can we add that to the symptomatic patients to get the total point prevalence in the population. But something like the Diamond Princess or any small segment of population, which is all we have where everyone has been tested, isn't necessarily generalizable to every population in the world, or most. We know there were other issues that affect how susceptible someone is and how likely the disease is to spread, such as how closely people are living. It's really no surprise that urban areas like New York City are so hard hit by the disease, especially when we're all being told to socially distance because people in New York City live very close together. So it's hard to avoid coming into contact with other people. And similarly, a cruise ship where one of those rare examples where we have almost a complete population picture and can know the asymptomatic cases close together. And if we go beyond that and are trying to project beyond just people who get the disease, how many people will get sick and will need advanced medical care and ultimately will die, we get to even more complicating factors. So going back to the Diamond Princess example, it's estimated from that ship that the fatality rate of COVID-19 among symptomatic people was 2.3%. But if you count the asymptomatic people on that ship, the people who tested positive for the disease, had the disease, or had the virus, but didn't have any symptoms, didn't get sick, the fatality rate is only 1.2%. But even that's not great as an estimate because, of course, there are population characteristics that likely affect mortality, and the population on board the Diamond Princess isn't necessarily, or almost definitely isn't representative of the world population as a whole, or even any specific geography's population as a whole. For example, some of the things that we've seen, of course, are that people with more comorbidities, people who are older, are more likely to have serious complications and die from the disease. And the proportion of people who happen to have comorbidities or be elderly on that cruise ship population isn't necessarily the same as the proportion of people with those conditions in other populations. So although something like the Diamond Princess, where we did test everyone, gives us a rare idea of asymptomatic cases and ability to extrapolate mortality and morbidity rates of the disease from that full population, including asymptomatic cases, it's not perfectly generalizable to other populations. It's just the best that we have. So another thing that we don't know about the coronavirus that's also hard to estimate is the number of people that the average person who has the disease or carries the disease as an asymptomatic carrier then infects. In fact, one of the most prominent models right now is the model from the Imperial College London. And they themselves, in the last 2 weeks of March, they revised that estimate. So in the middle of March, around March 16th, they were saying on average, someone who carries COVID-19 is going to infect 2 to 2.6 more people. But by the end of the month, they were saying that number is 3 to 4.7 people. One of the reasons that's a really difficult number to get at, beyond the fact that we don't know exactly how many people are infected, as I said, because it's really difficult to know the number of asymptomatic cases, is evolving discoveries of how the disease is actually spread. We're still learning whether and how long the disease can live on surfaces, how far it can travel between humans, whether it's aerosolized. All of these things impact how many people we can assume that an infected person is then going to infect. Another issue that comes into play with predicting an epidemiological model is the susceptible population. And that means who can get sick from the disease. So the original imperial model is, of course, assuming that nobody has immunity to the disease to begin with, which we don't know. And then another bigger unknown is an assumption that somebody who has been infected and recovered will not get the disease again, that they are immune from the disease because they're infected and recovered. Also, a pretty big assumption that's being researched now, but something that we don't actually know. So finally, going back to how many people get infected by each person with a disease, the imperial model originally assumed that somebody who's asymptomatic can still infect other people, but that they're 50% less infectious than someone who is symptomatic. But again, that's something we don't really know, and it's very hard to make any assumptions about asymptomatic people because the information we have about asymptomatic carriers due to limited number of tested people is so limited. So I hope you enjoyed listening and found this informative. Thank you for listening. The key takeaway is that mathematical models are important for predicting resource needs with something like coronavirus. But unfortunately, because of the unprecedented nature of the virus and the large number of people who are likely to be carriers and able to spread the disease but don't show symptoms, it's really difficult to have accurate projections. And that's why we see vast differences sometimes, for example, between the Imperial College model and what the Center for Disease Control in the US is projecting in terms of how many people are going to get sick and die from this. Thank you for listening. See you next time on Coronavirus TV.